For ReachMD, this is Audio Abstracts. The following is brought to you by Prova Education.
Cystic fibrosis lung disease is characterized by chronic respiratory tract infection with multiple bacterial species frequently dominated by Pseudomonas aeruginosa, which has been associated with accelerated lung disease progression, increased morbidity, and decreased survival. For patients with cystic fibrosis, the use of inhaled antibiotics has become the standard of care to suppress chronic Pseudomonas airways infection. There are limited antibiotic options formulated and approved for inhaled use, and because antibiotic efficacies attenuate over time, additional inhaled antibiotic classes are needed. Levofloxacin Inhalation solution is a fluoroquinolone in development for management of chronic Pseudomonas aeruginosa airways infection in patients with cystic fibrosis. In a study published in the Journal of Cystic Fibrosis in February 2016, lead author Dr. Patrick Flume and colleagues discussed a phase 3 trial assessing the effectiveness of levofloxacin inhaled solution in cystic fibrosis patients. This was a multinational randomized double-blinded study comparing levofloxacin inhalation solution and placebo over 28 days in cystic fibrosis patients at least 12 years of age who have chronically suffered with Pseudomonas aeruginosa infection. The primary endpoint was time to exacerbation. Forced expiratory volume and patient-reported quality of life were among the secondary endpoints. Baseline demographics were similar, although significantly more patients randomized to the levofloxacin inhalation solution group had experienced multiple exacerbations in the year prior to entering the study. There was no statistically significant difference in protocol-defined pulmonary exacerbations between treatment arms. However, relative change in forced expiratory volume from baseline was significantly greater for patients using levofloxacin inhalation solution compared to those randomized to placebo with a p of 0.01. Levofloxacin inhalation solution demonstrated clinical efficacy by a reduction in bacterial density and an increase in lung function. Although it did not meet its primary endpoint of reduction in exacerbations overall, it may increase the time to antibiotic treatment in those patients with a prior history of frequent exacerbations. Given its proven safety and tolerability record, levofloxacin inhalation solution demonstrates promise as a therapy for some patients with cystic fibrosis and chronic Pseudomonas aeruginosa infection of the airways, and is currently approved in the EU and Canada.
This has been a presentation of Audio Abstracts. The proceeding was brought to you by Prova Education. For more information and for reference links of this article, visit reachmd.com/audioabstracts.